Stem cell therapy has become the hot topic over the last few years, and I noticed that there were a lot of non-physicians jumping into this arena, probably more as a money grab than as a form of treating patients. So myself and Dr. Kwartowitz and Dr. O'Keefe, we spent a year researching some of the different options for stem cell or regenerative therapy. And we, about 8 months ago, started providing and offering stem cell therapy. And it's a big step to take because right now insurance doesn't cover that. And also the stem cell materials that we provide our patients, we have to purchase them and they're very, very expensive. But anytime you have to offer a service to patients that's not covered by insurance, it's a different arena. And instead of non-physicians offering this to people, we thought who better to provide stem cell regenerative therapy than your orthopedic surgeon or someone that has an understanding of the anatomy better than anyone else. We chose to offer human umbilical cord stem cells, non-embryonic, meaning these are stem cells from a healthy newborn delivery. We have added to our stem cell treatment a second vial of material from the amniotic matrix, they call it. Now, there are companies that would have doubled the price of that stem cell and we kept it the same. We feel that it's more important to provide a treatment that will get people better than to simply keep charging more and more. But we also offer patients that want their own stem cells the ability to do that. Our experience with the human umbilical cord stem cell has been tremendous. We first started offering the stem cell treatment, what we thought were for the younger, more active person that might have a small area of cartilage damage. Because all of the literature has been showing that in animal studies, the cartilage is regrowing. And for the first time ever, we're regrowing new normal cartilage. It's a bit of a technological breakthrough. I never thought in my career I'd be able to offer patients the ability to regrow their own new normal cartilage. Granted, this is still considered experimental, but we are now offering these human umbilical cord injections very often after we do a small, minimally invasive procedure called arthroscopy. And if we see an area of cartilage damage, we will prepare that area so that 1 week later, we do a simple little, often pain-free injection right here in the office. So when we started the stem cell therapy, it was to halt the progression of arthritis, hopefully reverse the arthritic process. But what we have found in the 120 patients that we have done stem cell injections into the shoulder, hip, wrist, ankle, knee, any arthritic joint, every patient is achieving significant pain relief. There are people that are either too old to be a joint replacement candidate, or they just have too many medical issues, whether it be their heart or their lungs, and they've been told by their internist it's not safe for them to have a big surgery. They're coming in with bone-on-bone arthritis. They're getting a stem cell injection, and some of these people are getting dramatic pain relief. So these are people, paying their hard-earned money or hard-earned saved money, and it's working. Many people are saying it was money well spent. You want someone that knows the anatomy like the back of their hand, has invested in new technology to make sure that this very expensive material goes where it needs to go. So it's a very quick, simple process. Literally, the stem cell injection can take 10 seconds. In terms of how long the benefits are of this stem cell, we are finding that within a matter of days or weeks, people are getting tremendous pain relief. What we don't know is how much new cartilage growth is taking place. And we may not know the answer to that for years. We are seeing people back after 6 to 12 months getting new x-rays and see if we see an increased joint space on the x-ray. And there have been a couple patients that we've seen that. There have been many patients where we don't see an x-ray change at 6 months, but some of them are pain-free and they don't care. They're thrilled. It's still a work in progress. To a certain degree, you have to take a leap of faith. I can tell you that I have a 20-year-old ski injury. I developed a significant shoulder injury. I was having shoulder pain that woke me up several times a night, and about a year ago I was thinking I might have to consider a shoulder replacement. my x-ray showed arthritis. I had serious, like searing, hot, burning poker pain if someone took a hot poker and put it in my shoulder. And I got really tired of that pain. It was affecting my quality of life tremendously. And I was worried I wouldn't be able to continue doing what I do, which is practicing orthopedics. I was one of the first patients in our practice to get this human umbilical cord stem cell injection. And I kid you not, after about 10 days, I noticed about half my pain was gone. I thought it was too good to be true. About 3 weeks later, I realized just sitting here, that hot, burning pain that was sometimes a 9 out of 10 was gone. And an interesting story. I haven't been able to sleep on this shoulder for 10, maybe 15 years. Well, about a month or so after I got my injection of the stem cells, I woke up in my own bed and I was disoriented. Why? Because I woke up and I was actually looking in the wrong direction in my bedroom, and for a second I didn't know where I was. So I can speak personally, for me, it's real. And the benefit of going through your day without the same amount of pain that you've been used to going through, and at times I have no pain, and I've heard this from many of our patients. It's exciting to be able to offer that to people, especially without having to have surgery. I think we're on a good path. There'll continue to be more research, more studies, but it's safe. First and foremost, it's safe. And if it can give people this kind of pain relief, my vision is that Lederman Kwartowitz Orthopedics becomes the leader in this space and the leader in this new technology. People know that they can come to LKO and be explained everything, be given the pros and cons, and they can make their own decision, but they know that they're going to get that treatment the right way. The medication will go where it needs to go, and God willing, they'll get great benefit and relief of pain from it. The people that would benefit from stem cell regenerative therapy is anyone with an arthritic or painful joint. And I know it sounds awfully broad, but it can include people with neck and back pain, whether they've got degenerative joint disease or disc disease. A very common question that patients have is, if I do the stem cell injection, do I have to miss any work? The answer is no. Am I going to be hobbled up at all? The answer is no. All we require before someone gets a stem cell regenerative treatment from our office is that they avoid taking anti-inflammatory medications for a few weeks beforehand. They avoid taking those for a month or so afterwards, and they avoid high-impact activities afterwards. They can do unlimited walking, biking, and swimming the next day. They can go back to work, and they can just carry on with their lives.